Good afternoon. I'm Julie SHIRLEY, Executive Editor of the Bellingham Herald. Thank you for joining us today for our second live conversation with those on the front lines of COVID in Whatcom County. Today we're focused on COVID and kids. We have lots of questions from readers, and you can continue to post more questions on whatever platform you're viewing on today. Joining us to answer your questions about schools are Dr. Greg Baker, Superintendent of Bellingham Public Schools, and Kim Niederhauser, Director of Health Services for Public Schools in Bellingham. And here to answer your medical questions are Dr. Sudhakar Karlapudi, the Chief Medical Officer at St. Joseph's Hospital, and Whatcom County's co-health officers, Dr. Greg Thompson and Dr. Amy HARLEY. In addition to their work with the health department, they are both board-certified pediatricians and practice as pediatric hospitalists. Now I'll turn this over to Bellingham Herald COVID reporter Dave Rasbach and our panelists. Dave?
Thank you, Julie, and thank you to those of you joining us today. COVID-19 continues to be active in Whatcom County as 179 confirmed cases and one related death were reported by the Washington State Department of Health on Monday. That brings Whatcom County's pandemic totals to more than 14,000 total cases, 723 COVID-related hospitalizations, and 139 related deaths. Of those, more than 3,500 cases and 21 hospitalizations have been in Whatcom County school-age residents under the age of 20. Last week, Linden Christian announced it would return to remote learning for 2 weeks due to a high number of cases at the schools. I'd like to thank our panelists for joining us to discuss the impacts of COVID on our kids and in our schools. We'll start with questions for our schools panelists first. Our first question is for Dr. Baker. Last year, the majority of schools began in remote learning. Why did the state of Washington and local school districts advise to choose to start the 2021 school year in person for both students?
Yeah, thank you. And thank you for having myself and our team here. The big change from my perspective from last year to this year is our knowledge. We know more, our health community knows more, our schools know more. And last year we had a whole year of learning how to navigate the pandemic as well as we can, how to put mitigation strategies into our school to reduce the chance of spread. And we got pretty good at it. Our staff and our kids in our community here in Bellingham have really worked hard to listen to the medical community and the evolving science and done what we've been asked to do. And so we had a high degree of confidence this year that we had last year of practice and that we were ready to open up per the governor and our state superintendent's direction. And we also learned how hard it is for many of our kids to be learning remotely and how valuable it is to be in person and surrounded by our staff and adults. So there was a real push by our governor and state superintendent, and we followed suit of get kids back in person, follow the health standards, and move forward. And I think our team has done that successfully well and continue to do so.
Thank you, Dr. Baker. Our next question is for Kim. What guidance are schools following to mitigate the risk at school? And what can families expect if their child is a close contact to a confirmed case of COVID-19 at school?
Sure, thank you. I'll start with the first question. We follow the Department of Health's K-12 requirements document, as well as we meet weekly with our health department and health officers, the schools team, and also meet with other schools in the county for support in interpreting those guidance and putting them into practice in schools. This is one of the silver linings of the pandemic, is building these strong relationships with our health department and other schools. In that K-12 requirements document, it lists all the layers of mitigation, and that's from symptom management. Testing is an additional layer this year. Vaccines, of course, is a really strong layer for us this year. Masks, hand hygiene, cleaning and disinfection, distancing, and the contact tracing, right? So yes, if we learn of a case in school, we quickly pull our COVID safety team at our site and at the district level together and walk through the whole course of that day, determine close contacts, and we call and notify the family that their student was a close contact. If the student is fully vaccinated, then they do not need to quarantine. However, the public health recommendation is that they should still get tested at 3 to 5 days after the exposure. And we, of course, recommend universal masking. If they are unvaccinated, then yes, they would be advised to stay home and quarantine for the remainder of the 10 days after the last exposure. The public health guidance is 14 days, and we're able to have students return to building at 10 days. That's been in consultation with our health department. So yeah, I think that answers the question.
Thank you, Kim. Our next question is for Dr. Baker. Why isn't daily or weekly pooled testing or random rapid testing being done at schools when it's been shown to drastically reduce the spread of COVID among students?
Yeah, I'll give a little perspective, and maybe Kim has some thoughts too. Testing, as you mentioned, is a great strategy, especially in concept. Operationalizing it, I think, is more challenging. When you have 11,000 kids and thousands of adults, and you say, "Hey, let's test everybody every day," just the mechanics of that is hard. One of the, Kim mentioned silver linings. One is that the staffing for health services things has been very small from the state, and this pandemic has kind of brought that to light. The state funds, for example, 1.7 nurses for our entire district, 11,000 students, 22 schools, 1.7 nurses. And so we have to supplement that. So part of it is staffing. Schools just aren't staffed with health professionals in every building. With dollars that we've had, though, we've been able to increase. And as Kim, she's our first director of health services we've had. And so we are working with our health department and partners on how to be strategic around testing and try to build up our ability to do it. And we are doing that. But to take it to scale, it's just hard for most places to figure out, at a school setting, how to really operationalize that. So our team continues to work at it. More and more kids strategically are being tested with certain criteria. And that's an area that I think schools across the country are trying to figure out how to use testing as one of those key mitigation strategies.
Thank you, Dr. Baker. Kim, did you have anything you'd like to add to that question?
Yes, I would. Thanks. The goals that we've been given by the CDC, the Department of Health, and our governor is to maximize in-person instruction and minimize the transmission of COVID-19. So we're looking at testing strategies that can help achieve those goals. So we're focusing on identifying those with symptoms and assuring their access to timely testing. We're working at building up our capacity to be able to offer that testing here at school, and focusing on those with barriers to getting to that community testing so that we can quickly identify if it is a case and do our contact tracing, but also to be able to get students back in our buildings with following our protocols with a negative test and feeling better. And I think that was the main point. We're also focusing on requirements with athletics and looking at continuing to build that capacity and testing.
Thank you. Our next question is also for you, Kim. And it's a question we may also address to our health officials later on during this panel. Some people are concerned about children wearing masks. What is the data showing that masking is effective in schools?
There's a lot of recent data that's come out. The CDC posted a report on really clearly showing that schools with universal masking in place have much lower case rates. So universal masking along with vaccination are really our strongest tools in keeping our schools safe. And our kids are great at wearing masks. Last year, my son started kindergarten, and we were spending all of our time at home, and I hadn't been doing much practicing with masks. And when he went back to school in person, I picked him up at the end of the day and said, "How was it wearing a mask all day?" And he said, "Mom, I'm great at it." And he likes to wear the mask, especially on the cold days. It keeps him warm. So we're finding that, kids are doing great with their masks.
Thank you, Kim. Next question is for Dr. Baker. Has Bellingham Public Schools considered purchasing tents at every school to allow students to continue eating outside during the rainy season, which is now upon us, obviously, knowing that outdoor eating is much safer during the pandemic than indoors?
Yeah, tents is something that since the beginning of the pandemic has been conversation with school districts across the country, including ours. It's another example where it sounds great in theory, but operationalizing it can be a bit more challenging, whether you think about a school with 1,000 students or 500 students, how do you get a tent or tents to hold everybody, or windy days like today? So you really have to keep an eye on safety of tents. And so we continue to explore it. We'll probably see some tents, but they're not the best long-term strategy. So other things that we do is a number of our newer buildings especially have large garage doors that open up to the cafeteria. If you think about Shuckson Middle School, Happy Valley, so our newer schools, and that's a great way to bring in air and circulation. The other is outdoor areas that are covered. So some of our schools have playgrounds with large covered areas that are stable and secure. We have courtyards. We continue to look at our current facilities, our newest schools. Some of them have covered play areas, covered outdoor areas where we've bought picnic benches and kids are eating out on picnic tables. And I think as we build our new schools coming up in the near future, the pandemic has emphasized how do we keep building a cafeteria that has big garage doors and covered outdoor areas, and not rely on a tent that may or may blow away, or how do you secure it? So we do have some tents, and we'll probably see some others, but I think those other solutions tend to be a little bit more sustainable and safe.
Thank you, Dr. Baker. Our next question is for Kim. Are schools having problems getting students to wear approved masks rather than neck gaiters or masks with valves?
There might be some isolated situations there. And with we're following the requirements, we're following the Secretary of Health's mask order and looking at that language. And so if a student does come with a mask that's not the best, then we can offer, we have masks here to offer students. But there's ways that we can work with students. Ultimately, something's going to be better than nothing. So in the case of net gaiters, the CDC does say that if you double it over, it becomes a 2-layer. And the valves, that's not per the mask order. So then we'll offer them another mask.
Thank you, Kim. And our next question is also for you, and it comes from a reader, Ruby. Are schools requiring kids to wear masks at recess? And if not, why not?
Yes. Well, we're following the Department of Health again, K-12 requirements and the the Secretary of Health's mask order, in that masks are not required outside. But certainly, if anyone's seen the elementary recess, we've wondered, does this count as a crowded event? And the Department of Health, in meeting with them, have said no, that would not be considered a crowded event. That the recess is a great time to take a mask break. But we have framed it that masking is optional outside, and certainly if any student wants to wear it, and we want to support them in wearing it. Our recesses are also shorter in duration. Kids are moving, and we teach to that.
Thank you. Our next question is for Dr. Baker and comes from Bree in Bellingham, who asks, how is exposure being handled in elementary classrooms if one child tests positive? Is the whole class shut down? And is your approach different this year than it was last year?
Yeah, great question. I might defer more to Kim on this. Things have changed as we get more and more people vaccinated, and as the guidance continues to change from our health officials. But let me turn it to Kim to talk about, so if there's a case in elementary school, what happens?
Yeah, thank you. So it's true, last year, because we were set up to do remote, then it might be that, yes, the class would go remote. This year, it's about identifying those who are close contacts and finding out if they're unvaccinated, and then having them go on quarantine if they are. There could be situations in our younger learners where the nature of learning at young ages is it's not feasible to expect them to remain 3 feet apart for an entire class day. So it might be that a younger class might go remote. But for right now, we're just identifying those who are close contacts in the classroom.
Thank you, Kim. And this next question is also for you. What mental health and other effects are being seen in children and adolescents as a result of the pandemic? And how are schools responding?
Yeah, no, this was really important. And if you recall, the governor declared a children and youth mental health crisis last spring, and ordered students to get back in person. So we know how important it is for students to be in person and connecting And I might have actually Dr. Baker speak to, I know in our district, looking at adding supports for students in mental health.
Yeah, what I'd add is similar to how I said our state funding model gives a district our size just 1.7 nurses for the entire district, which most people find hard to believe. There's no allocation for mental health services. So we've never had mental health specialists in our district until just recently. And because of the need and the importance that is in some ways been highlighted, certainly by the pandemic, we've hired our first mental health coordinator, whose job it is to help provide mental health services to kids in our district, but also reach out to our community partners, who we've relied on for 100 years of how can they help support us as they have capacity. And sometimes that ebbs and flows with state funding for mental health services in the community. And then since the pandemic, we've hired 2 more mental health specialists. So we now have 3 full-time staff whose job it is to help figure out how to help support our kids, and in some ways our staff and families and community with that. So we went from 0 staff that were focused on mental health in terms of specialists a few years ago to now having 3. And pretty much, that is because of the support of our local community supporting our levies. And then certainly some federal help lately with the pandemic has helped districts do some things like that. That short-term funding does not last for, continue.
Thank you, Dr. Baker. Our next question is for Kim. Many people have been waiting the chance to vaccinate children younger than 12 for COVID-19. Will the district have resources to help once that vaccination is approved for younger learners?
We will do whatever we can to help support those efforts, help our health department and our local health care providers in the community, and be ready. And we wish we knew when it was coming. We've heard anything from by the end of the month to the start of the year, but I hope it's closer to the end of the month. And yes, we'll be ready to support and make it easy for families to access that.
Thank you. Our next question is for Dr. Baker. California is planning to mandate coronavirus vaccine for all school children once the shots gain federal approval for everyone 12 and under. Do you think Washington should do this? And will our school board be considering a COVID vaccine mandate for those over the age of 12, much like is already in place for other vaccines?
Yeah, and our health officials can help clarify if I say something that's not quite right. In terms of what vaccines are mandatory for students, and we have lots of those in our state and across the country. It's not a new thing to have vaccines mandated for kids. That's not a superintendent or school board decision. I believe that comes from the State Department of the Board of Health, and they might fine tune the language of that. But there's a state board that makes the decisions, I believe, on vaccination. So as a school district, we will wait to hear from higher up about whether this vaccination gets added to the requirement list or not. And if it is, then we will fully support that, just like we do all other mandatory vaccinations, and work with our families and our kids and our community partners to help ensure that kids are vaccinated. So from my perspective, it's a wait and see, and we'll follow the experts.
Thank you, Dr. Baker. Sticking with the subject of vaccinations, this question's for you. Will the state's mandate for school employees to be vaccinated cause any problems for Whatcom County schools, and particularly Bellingham Public Schools? Yeah,
I'll pretty much just speak to our school district. The mandatory for all staff, from my perspective, is very positive. It's helped add to the reasons why staff should get vaccinated to keep our kids and our staff and community safe. And so we're following it. Right now, we have 100% of all of our administrators that have been vaccinated. We have over 98% of our teaching and certificated staff vaccinated. So overall, I think it's very positive. It certainly, as anyone reads in the news, can cause some challenges. We have some folks that will go through the process and have an exemption. Some folks that would rather, not have to be forced to have it. So that's certainly out there. districts are worried, like other places that have mandatory vaccinations, how many staff might you lose? So that's a concern. And we already have a shortage of staffing in many ways already. So this could add to that. And it might depend upon where you live in the county, the state, and the country. For us, we don't anticipate that being a large impact of staff that will have to leave employment here. I think it will be very small. So that's our take right now, is that our staff are really working hard, almost, in a big way to follow that mandate.
Thank you, Dr. Baker. Our next question is for Kim. What's the plan for supporting students with lingering COVID symptoms?
Well, I think if it's going to be that they're going to be out of school, then we would work with the principal and the teacher to be able to support them in their learning. So I'm not sure if that's more of a question for our health officers or the hospital on the call.
Thank you, Kim. We'll address that in the second segment of this panel. Our next question is for Dr. Baker. What is the case threshold that needs to be reached before schools or classrooms return to virtual learning?
I don't know that there's any magic number from my perspective. The health department might have their own answer. To return to virtual learning, could happen because of a governor mandate, which is what happened last year. It could be because the health department and or school district or in collaboration decides that it needs to happen. Right now, I don't foresee that happening in our district. The percentage, as I said, of staff that are vaccinated, our eligible students that are vaccinated is high. And as Kim said, we hope that our younger students have access to vaccinations here shortly. So I don't think there's any number. I think it's probably, if that decision was made, it's like looking at many factors. How well are staff and kids following the mitigation, whether that's mass vaccinations, and how steep is the curve of cases going up. So I'm guessing it's more complex than one number would be my sense.
Thank you, Dr. Baker. Our next question is for Kim, and it comes from Laura in Bellingham, who says that my child reports that she cannot safely space in her classroom due to 27 kids and 2 teachers being assigned to a portable unit. In addition to this, the windows don't open due to air conditioning units. And she says, I'm certain if attendance figures were examined, it would show more absences due to sickness in this classroom compared to others. Another classroom in the school has 12 children in a larger space. She says she's already reached out to the school principal. What other options does she have to express her concerns, to address her concerns?
Sure. Thanks for that question. I want to get to all of that, but I want to back up to the previous question about supporting kids with long COVID. I think my initial thought was coming from my medical and public health background, and I'm realizing that, if any student has a health condition, our nurses and our teams work with them on accommodations at school. So I just want to point that out. If there's anything that someone needs to be successful learning, we're here to make that happen. So let me jump on to ventilation. So first of all, we do have our director of facilities, and we have a dedicated HVAC technician. They've gone around our buildings. They've looked at the portables, and the portables have, in any of our buildings, looking at increasing that fresh air into the building. When it comes to distancing, that is one of the layers that we have, the layers of mitigation, but distancing should not be a barrier to in-person instruction. And we're finding the science is showing that really, masking is our strongest tool that in vaccination. So certainly we are putting in distance where we can get that distance in. And then as far as, I would say, call me, happy to talk with you about the specifics of your child's classroom. We can also speak with Mark Peterson, who is our director of facilities, and Dr. Baker is happy to hear from parents as well.
Can I just add to that, Dave?
Please do.
Yeah, just to what Kim said is, and I think, parents, they may not follow this completely. A year ago, the distancing was mandated, which is why most schools, when they came back, most districts had to go just 2 days a week, and you had smaller numbers of kids because you had to maintain distancing. Because of what we've learned, and as Kim said, the masks are an important layer of mitigation, less so than the distancing. That's not now a requirement. It's distance as much as possible. So having 27 students in a classroom and 2 adults, while it is closer than 13 kids and an adult, fully fits within the updated guidelines because of what we've learned. And we have classrooms all over the city that would have large number of students and such. And it's those other factors that matter most. So if any parent has concerns, certainly what Kim said, they can contact her and me, but it is different than last year. Last year, we wouldn't have had 27 students because there was a distance requirement, where that is now changed because of what we've learned. So that's a change that maybe not everybody is quite aware of.
Thank you, Dr. Baker. And I kind of want to circle back to something you mentioned we were speaking about earlier. How much is the district looking at air quality in schools as a way to stop disease transmission? You mentioned garage type doors in cafeterias at some of the newer schools in the district. What about classrooms? What can be done to improve airflow in areas where students are even more often? Yeah,
the air quality in our facilities are overall outstanding and fit the requirements. We're fortunate in our district to have great facilities. We have a lot of new schools, and our old schools have updated HVAC and filters, and we meet all the requirements. So we're good to go, where other places around the country have really struggled. So we have the proper circulation. And sometimes it's counterintuitive. Like someone might say, well, we just didn't want to open windows to get more air in. But that actually may not be the right answer because of how our circulation works and replaces with fresh air multiple times per hour. So our team works hard on each space to ensure that it fits within the requirements. Those garage doors are often when we're talking about the large cafeteria. And it just is an extra bonus just to have, to be somewhat outside but covered. But we have made sure that all of our facilities meet the requirements of air circulation and ventilation. And I feel fortunate that overall we have great facilities in our district that allow us to be able to do that fairly easily.
Thank you, Dr. Baker and Kim. Really appreciate you joining us to discuss what's going on in Bellingham Public Schools. And I invite you to stick around if there's something that you'd like to jump in on when we switch topics here a little bit and move on to some of our medical related questions with our panelists from the Hospital and Health Department, including Dr. Carla Pudi, Dr. Thompson, and Dr. Harley. Our first question for this section is for Dr. Carla Pudi. There's a perception that COVID is less dangerous for children than for adults. What would you want families to know about when children become ill with COVID compared to adults?
Thank you, thank you, Dave. Thank you, everybody. Thanks for inviting us again. We know from the beginning of this pandemic that compared to adults, fewer children have become symptomatic from this disease. But as Delta has progressed, and I will defer to Dr. Harley and Dr. Thompson to talk about, the impact we are on the exact impact of the progression of Delta on COVID on children. We know that more children have become symptomatic, and we know that more children compared to the original strain have required to be hospitalized. So while the impact in terms of serious illness in children, thankfully, has been less than that of adults, we have seen an increase from the Delta strain than we did with the original native strain.
Thank you, Dr. Carla Pudi. Dr. Harley, would you like to add anything to that question?
Sure, I'd be happy to. As Dr. Carla Pudi mentioned, we know that the symptoms of COVID-19 are more mild in children. Kids might just have a sore throat and fatigue, or a runny nose and headache. It's important to be vigilant for these symptoms in your children and test if you suspect infection so that you can avoid spreading the disease to others. We now know that children can easily transmit this virus. And again, while the serious illness rate is low relative to that of adults, life-threatening illness and death have occurred in children. Children can also suffer complications such as long-term symptoms or a post-infectious multi-system inflammatory syndrome that causes dysfunction of vital organs. So serious outcomes have become more prevalent with this Delta surge and may continue if we don't prevent the spread in our communities. Children now account for a greater proportion of COVID cases than they have in the past. This time last year, children accounted for 1 in 10 cases of COVID in our country, and now it's more like 1 in 4. I also can speak a little bit to the situation at our local hospital. I just want the community to feel confident that the pediatric hospitalists at St. Joe's are committed and ready to care for children in our community that are becoming ill with COVID-19. We've worked hard to increase our hospital's capacity should we continue to see a significant increase in cases in children. And we've also really coordinated with our regional referral centers on transfer criteria for critically ill children that exceed our ability to care for them. But we really do need our community to help us, not to need all these contingency plans that we've made. And we can form a protective wall of immunity around younger children that are currently not eligible to be vaccinated. And we do this by vaccinating older children and adults, and also continuing to use the preventive measures such as mask wearing and avoided crowding settings that Kim mentioned earlier.
Thank you, Dr. Harley. Dr. Thompson, would you also like to speak to that question?
Oh, sure. Yeah, I'd mostly echo what my colleagues have said. You know, the only other point that I would add is even though children do tend to be more resilient in the face of a lot of these illnesses than older people, we have seen serious cases. You know, I know Dr. Harley working at St. Joe's and myself working at Skagit Valley Hospital have had children that we've had to hospitalize, some of them young infants, some of them school-age kids. We've also both of our teams have had to transfer some children to Seattle Children's Hospital for higher level care that we weren't able to do at our local hospitals too. So even though most children do very well with this, some do get quite ill. And in terms of comparison with flu, just to put that in reference, you know, a bad flu year will have about 175, 180 deaths in children, and these are bad flu years. In COVID, we've seen at least 550 deaths across the country in children from this disease. So it is real, it's serious. We don't want people to freak out, but we do want people to be vigilant.
Thank you, Dr. Thompson. And our next question is for you. What are the current case and vaccination rates among children in Whatcom County?
Yeah, sure. So as far as cases in Whatcom County, let me first kind of start by contextualizing where we're at in this pandemic as a whole. You know, everyone has seen the epi curves and you see the waves go up and down. We're currently in our 4th wave or 4th surge in Whatcom County. And this surge has peaked at a higher rate than any of our previous surges, including last winter when everything was shut down. That said, we believe we are just past our peak and leveling off or starting to go downward. As far as specific numbers, case rates are a thing that are a little bit hard to visualize, but the way that we measure these is by looking at total cases per 100,000 population over a 1 or 2 week period. And that just allows us to compare over time and also compare between different geographic areas. So those numbers right now for children, school-age kids between 5 and 17 years old range from about 550 to about 700, depending on which age group you're looking at. And for context, that is 3 times higher than what the CDC would consider an area of high transmission. So we're definitely at or very close to the highest levels we've seen, although again, those are leveling off and starting to just trend downward slightly. When we look at vaccines in this age group, so it varies very dramatically across Whatcom County. We actually have rates as low as 30% in some parts of the county in 12 to 17-year-olds, rates as high as 80% in other parts of the county. Looking at the county as a whole, 57% of kids have gotten at least their first dose. And we actually do have data on breakthrough cases in children as well. And what we're seeing is since July 4th, when Delta became the prominent variant in Whatcom County, that we have about 5 times the rate of cases in unvaccinated kids that we do in vaccinated kids. So we're seeing high levels of protection from the vaccine. It's not 100% protective, but just like a seatbelt won't prevent all deaths in car accidents, the vaccines aren't 100% effective, but they definitely help very, very dramatically.
Thank you, Dr. Thompson. Dr. Harley, can you speak a little bit to what the difference in infection rates for kids between COVID and the common flu or the seasonal flu?
Sure. I mean, I could say generally that COVID is much, much more infectious than influenza. An average person with this Delta variant could infect as many as 6 to 7 people. And sorry, what was the rest of the question?
You basically answered it. The
Okay.
difference in infection rates between COVID and the seasonal flu.
Yeah. Yeah, and
And
as Dr. Thompson mentioned, not only is the influenza much more infectious than COVID-19, it is more deadly than a typical flu year as well.
Thank you. Our next question is also from you, and it comes from Lynn in Whatcom County, who asks, after a child gets vaccinated, is it safer for a grandparent to be around them?
Absolutely. I think that if a child and their parents and grandparents are all vaccinated, that everyone in the family can be confident that they are as protected as possible against severe disease from COVID-19. Grandparents should also get their booster shots if eligible. And obviously, if someone develops symptoms of illness, you would want to avoid gathering temporarily. But these family connections are really vital for the emotional well-being of children and their grandparents. Vaccinations are a way to ensure that families can continue to safely enjoy each other's company.
Thank you, Dr. Harley. Our next question is for Dr. Thompson, and it comes from Ken in Bellingham, who asks, our daughter will turn 12 in early November. Should vaccines be approved for the 5 to 11 age group prior to a birthday with a smaller dose? Is there a recommendation as to whether she should take the 5 to 11-year-old dose or wait until she turns 12 for the larger dose after that age group? And why is that important?
Yeah, well, thank you for the question. I can relate. I've got 2 teenage daughters, so congratulations on being the parent of a teen. It's a pretty exciting and sometimes challenging time. So best of luck and enjoy that time. As far as that specific situation, it's pretty unique. If I was in the office with you and you were sitting across from me, we were talking about this exact question, I would tell you that I don't think that we have perfect data and perfect science to give you an absolute answer on this. In terms of my recommendation, I think if we are continuing to have high levels of COVID transmission in the community, I would probably opt on the side of getting that dose sooner with the smaller dose. And actually, let me put this in context for people. With the Pfizer dose that's released now, the standard dose for people 12 years and up is a 30 microgram dose. That's what everyone gets. For children 5 through 11, Pfizer has applied for an emergency use authorization for that in these younger children using a dose that's only 10 micrograms. So it's a smaller dose. And the reason for that is, based on their data, they've seen that young children have a very robust immune response to the vaccine, and they don't need as high a dose. And that's something we see a lot as a general principle, I think, in pediatric infections. Young children have very robust immune responses they're really primed for encountering lots of new things. And so they react quickly and develop a good long-lasting immunity often. So in this case, it would be a lower dose for her if she gets it before her 12th birthday. Assuming that it's authorized, I think that I would be confident saying getting that first dose now if we're still having high transmission would be a good idea. And then she'll turn 12 and she'll get the higher dose for her second dose in that series. So that would probably be my advice, but I would definitely want to sit down and chat with you and kind of go over the pros and cons if there are any in your specific circumstances.
Thank you, Dr. Thompson. And this next question is for you, and it kind of goes back to a topic we were discussing with our school district panelists earlier. How effective is masking in preventing infection in children?
Sure. Yeah. As Kim said, it's very effective, and I think we have more data now than we ever had before. I know with the discussions of masking in school-age children, there were a lot of people saying, "Well, show me the data specifically in school-age kids," and we do have that now. In the last month, we've actually gotten some really good studies published looking at specifically the United States this school year with Delta variant being the predominant variant in the schools. There was a very large study done in Arizona, and my understanding is this actually covered schools that were attended by 75% of the kids in Arizona. So it's a very large data set. And what they did is they compared schools that did not have mask mandates in place at the beginning of the school year, or mask requirements. And they compared those with schools that did have mask requirements in place when kids went back to school. And they found that the schools without mask requirements had 3.5 times the number of outbreaks compared to those that did have mask requirements. So the masks definitely reducing the risk of outbreaks in schools. We also have broader data looking at schools across the country that went back to school in August. And if you remember, this is when our Delta surge was increasing dramatically. And they found that in those counties that had mask requirements in schools, the rate of increase of COVID from Delta was much, much lower than in the counties that did not have those in place. So quick answer, masks definitely help in school-age kids. Long answer, got lots and lots of data out there to support it if you want to kind of get your hands dirty and look at the numbers.
Thank you, Dr. Thompson. Our next question is for Dr. Harley. Linden Christian recently announced that it was going to close for 2 weeks due to the COVID presence on their campus. What is the process that goes into closing a school or returning to remote learning for an infectious disease?
Clearly, closing a school is always a last resort when it comes to controlling disease among children. And, you know, it's a complex situation and we take into account many factors. We're always monitoring for outbreaks in all our schools, but we don't make our decisions for our recommendations based on the numbers of cases alone. We also take into consideration how widespread the outbreak is, as well as the school's implementation of preventive measures, their capacity to isolate cases and also to rapidly access testing and to identify and quarantine close contacts. Our goal is always to apply more targeted measures whenever possible. And there have been some school-based outbreaks in our county where we've been able to be very precise in our interventions. But we rely heavily on the schools to help us form our recommendations and by providing us with complete information and to prevent these situations from ever happening by fully implementing the comprehensive preventive measures that are required by the state.
Thank you, Dr. Harley. And kind of following up on that question is one from John in Whatcom County, who asks, what can the rest of the public and private schools in Whatcom County learn from the Linden Christian outbreak? Were there specific mitigations that didn't work there or weren't followed to isolate COVID cases once they started showing up?
Yeah, I would say what we can learn is that this Delta variant surge has been humbling and overwhelming for all of those who work in service to our children and our community. And we've really learned that the Delta variant seems to take advantage of any weakness in our defenses. We're still, as Dr. Thompson mentioned, we're still at very high levels of community transmission. And the case rates are higher in school-age children in our county than they are in adults. Although our perseverance has been severely strained, the biggest lesson is that it's not time to relax our prevention measures. As I mentioned, the Department of Health has very specific recommendations for multi-layered prevention measures in K through 12 schools that we know are effective in keeping schools stay safe and stopping these outbreaks before they become widespread. Some of the most important of the mitigation measures that need to be consistently followed are universal masking, physical distancing, of course, to the degree possible, the testing, isolation of cases, identifying and quarantining close contacts that I mentioned. And also, it's really essential that we all work closely together and mobilize all the resources available to help schools in this regard. They really need to be working closely with public health so that the outbreaks can be quickly identified. And again, so that our interventions can be as targeted and specific as possible.
Thank you, Dr. Harley. Our next question is for Dr. Carla Pudi, and it comes from Bree in Bellingham, who asks, what's the most common way that COVID is spread from person to person, assuming children are masked at school?
Thank you. That's a great question. COVID transmits through three main ways. The first way is inhalation. The virus gains access to the human system, and because we inhale either respiratory aerosols or droplets, the second main way of transmission is actually deposition. So if you're in close contact with somebody who's actually sneezing, coughing, or singing, there are respiratory droplets that can directly deposit on mucosa. And the third most common way is actually our fingers. Our hands come in contact with the infectious droplets, and then we accidentally touch our face, and then we bring the virus into and with our own hands. So that's why masks work, because they form that barrier in preventing us first from from inhaling anything, and then finally from us inadvertently touching our face with our hands. So those are the three main ways that this disease spreads.
Thank you, Dr. Carla Pudi. Our next question is for Dr. Thompson, and it also comes from Bree in Bellingham, who asks, are hospitals seeing kids with COVID? And if so, are they healthy children or are they ones with underlying conditions?
Yeah, and the very quick answer is yes, we are seeing children, and we're seeing both situations. As I think Amy spoke to earlier, and I've experienced myself, we've hospitalized a number of children in our community hospitals here. The majority of those and this is me just thinking back to patients rather than looking at specific statistics, because honestly, we don't have a great mechanism for looking at underlying conditions in children and reporting on this, I think, at a public health level. So that's data that we don't have in that sense. So I'm looking a little bit more at anecdotal experiences. And the majority of the children that we have seen hospitalized at Skagit Valley Hospital have been children without underlying medical conditions. And most of them have done well, recovered quickly, and gone home. But like I said, there have been those that we've needed to transfer for higher level care. Of course, like any respiratory illness, kids who have underlying medical conditions are going to be more at risk of progression, and it should be taken more seriously in those cases. And I'd say if you have any worries about your kid's underlying health status and you have concerns that they have COVID, don't hesitate to contact their primary provider and talk to them about that as soon as possible.
Thank you, Dr. Thompson. Our next question is for Dr. Harley and comes from Laura in Bellingham, who asks, what is being done to increase test capacity and provide rapid results in Whatcom County? She says the wait for us in Bellingham was 4 days last week, but it was only hours in Skagit County.
That's a good question. So Whatcom County is in a very particular situation in that we border with Canada, and our testing resources have been had extra demands placed on them because of travel testing. So we're trying to meet those needs and also make sure that people with symptoms or exposure can access rapid testing in our county as well. There are a variety of ways that people can access testing. There's the Bellingham Airport community testing site, which people can sign up for on their own through Test Directly, and they've expanded staffing and the hours that site is available to increase capacity there. Also, you can access testing through your medical provider. Medical providers can collect and send a test to Northwest Labs or other labs, and also can order tests so that you can access the test collection site that's on Meridian at Northwest Labs. Other options for testing include local pharmacies, and excitingly, we are seeing that many of our schools in Whatcom County are coordinating with a program offered through the Department of Health at the state level to make schools community testing sites for their students and families within their schools. The schools all have a variety of I guess there's a diversity in the ability of schools to offer this service right now, but the vast majority of them are working on it. So that should really help to increase capacity to test children and families within our county. Additionally, the health department is always available to offer help to access testing, especially for those who have symptoms or have been exposed to COVID-19. We can often help people get access to a test the same day or the next day. So that's an option as well.
Thank you, Dr. Harley. Our next question is for Dr. Carla Pudi. If a child is diagnosed with COVID, what do you recommend as far as care at
Thank you for that question. I'm not a pediatrician. Can I ask one of my pediatric colleagues on the call to help me with this question?
Absolutely. Dr. Thompson, would you like to take a shot at that question?
Sure, absolutely. So if your child's diagnosed with COVID, I think the most important thing to begin with is to isolate them from spreading the disease further. So that's number one. And this, of course, is assuming mild illness. If they've got what look like typical cold symptoms, a little bit of runny nose, a little bit of cough, we would treat it essentially as you would a cold, but just being extra vigilant for progression of symptoms. So the same things we tell everyone, make sure you're well hydrated, make sure you're getting plenty of rest, make sure you're keeping a close eye on them. If they develop any breathing problems, if their urine output is going down, looks like they're getting dehydrated, or that they just look at you and something doesn't feel right, anything suggesting they're having more trouble breathing or anything, then I would get an appointment immediately. And depending on how bad it is, of course, you could either go into clinic or urgent care versus go into the emergency room or call 911. But for children who are mildly ill with COVID, I would approach it as you would any kind of cold or flu, just being aware that there is that risk of progression and being vigilant.
Thank you, Dr. Thompson. Dr. Harley, is there anything you'd like to add to that question?
I agree with what Dr. Thompson said. I think supportive measures and then monitoring in case it should become more severe. Of course, always reaching out to your healthcare provider if you have worries or concerns.
Thank you. Our next question is also for you, Dr. Harley. What have you seen in terms of the effects of the pandemic on children's mental health, and how can we best support kids coping and resiliency during this time?
Yeah, emotional and behavioral health challenges in children were of concern before COVID-19, and the pandemic has certainly worsened these challenges. Social isolation has taken a toll, as well as the loss of normal routines and usual milestone traditions. There's also, for vulnerable children and families, been a disruption in really vital supports and services that they rely on for support. And tragically, an estimated 40,000 US children have lost a parent to COVID-19. So clearly, limiting COVID-19 infections within our community is an urgent need to try and ameliorate these effects. And thankfully, however, even during the pandemic, everyday things we do can really help our children persevere through the fear and uncertainty that they have struggled with in this time. We need to help them retain a sense of hope. Maintaining healthy routines and strong bonds with family and friends are especially important. Caregivers should also prioritize their own self-care and access their own social support networks to ensure that they are ready to listen to their children's feelings and worries and teach children how to manage their emotions and behavior. And as we have noted throughout this forum, we also need to continue to work hard to keep our schools safe so that children can access in-person learning with all the associated benefits that entails.
Thank you, Dr. Harley. Our next question, I'm going to start with Dr. Carla Pudi, but Dr. Thompson, Dr. Harley, if you have something to add, please feel free to do so. What are your recommendations for the Halloween participation this year? And any thoughts about upcoming holidays at Thanksgiving and Christmas and possible travel for those?
Yes, this is the time for celebration and holidays for sure. And I think, as we all know, it's very important for us to, connect with each other as human beings and engage in these traditions to help us gain some sense of normalcy and a sense of healing from what we have been through. And I think Halloween is a particular favorite of mine, and I know that a lot of us go visit our neighbors and have a good walk in the neighborhood and say hello to each other, and children get all the sweets. But I think this year, based on the conversation that we have had thus far, we know that the single most important thing that we could do is wearing a mask. In circumstances when we are not certain on the vaccination status of everybody in our community that we might accidentally or intentionally come in contact with, the single best thing we can do is to make sure that we are wearing a mask. When it comes to travel, CDC has come up with very general guidelines in anticipation for travel happening with Thanksgiving. And I'm anticipating as we get closer to Thanksgiving, there'll be region-specific guidelines that CDC will provide. As of now, the travel guidelines say that if you are vaccinated, then please follow all the transportation guidelines for masking, social distancing, and very, very importantly, wash your hands, because our hands can come into contact with very innocuous looking substances and only to infect ourselves with it. So wash your hands and don't touch your face. If you wear a mask, then you can't touch your face anyway. And those who are not vaccinated, the recommendation is to please hurry up and get your vaccine because it is very protective from severe disease. And also, a general guiding principle is whoever you're going to visit with, please connect with them, have a conversation about expectations, and to make sure that everybody has a good holiday. But I will defer to the other experts on the call if they have any other advice.
Absolutely. Dr. Thompson, do you have anything you'd like to add?
No, I think Dr. Carla Pudi summed it up great. The other thing that I would think about is alternatives to larger gatherings where you're walking around the neighborhood, is think about, the possibility of a small, cozier gathering, just to reduce the number of exposures. But I just echo everything that Dr. K said.
Absolutely. Dr. Harley?
Yeah, I just, I don't have anything really of substance to add. I mean, I think it is a concern for exposing our children to lots and lots of people in airports or, around the neighborhood. Or I just encourage people to be creative in thinking about solutions to these problems. Last year in our neighborhood, we normally have, throngs of children lining the streets, and we last year took some measures to sort of limit that and made smaller outdoor gatherings where the children still felt like they were celebrating and enjoying some of the traditional aspects of Halloween, and yet we decreased the potential risk to them of being infected. And so I just want to encourage people to find creative solutions to meet the needs that kids have to participate in all the important parts of these holidays, but also keep in mind that we're still at really high community transmission rates.
Thank you, Dr. Harley, and thank you to all of our panelists. We have come to the end of our panel discussion here, and I'd like to thank everybody for taking the time to tune in and listen, and to our panelists for offering their advice. I'd also like to say thank you to all those who sent questions to us. Sorry we weren't able to get them all in, but we just ran short on time. Julie, I'll send things back over to you to wrap up.
Thank you, Dave. And thank you to our panelists and viewers for joining us today. There's so much great information. If you're not already a subscriber, you can support our local reporting by joining us at bellinghamherald.com/subscribe. We'll be posting today's conversation on our website and social media channels if you want to view later on today, and continue to cover COVID. Dave has done a great job this year and last, unfortunately, we've had 2 years of it now. But we do a lot of COVID coverage, and we invite you to read that daily. So thank you for participating in this Bellingham Herald video, and have a good afternoon.